Hello everyone, my name is Mike Donovan. I'm a certified registered nurse anesthetist. I have been doing anesthesia for about 16 years. I received my doctorate in nurse anesthesia practice in 2018. My business partner Tim McAdams, who is also a CRNA, have been doing anesthesia for 16 plus years. We have been involved in Cranford costoplastic surgery in some capacity and for about the past 12 years. And so it was decided by the surgeons that it might be a good idea to post a video or series of videos explaining some of the process and planning that goes on with the type of anesthesia that you're going to have if you are having a procedure or surgery at Cranford costoplastic surgery. So I'm going to talk about a number of things very briefly here. First of all, I am going to talk about the telephone call you'll get or should get the night before to go over the anesthesia, and then we're going to talk about the type of anesthesia you're going to receive. We're going to talk about when you can eat or drink after midnight the night before or the next morning, the day of your procedure. We're going to talk about that. Talk about meds you can take that you normally take the day of surgery, pain management, and some of the post-op plans and what you can experience after, what you can expect to experience after your surgery. So jump right in. It was decided several years ago that Tim and I decided to start calling patients the night before to talk about the anesthesia plan. We found that a lot of times most patients are more anxious about the actual anesthesia than they are the procedure. And so this helped to alleviate some of the anxiety surrounding the entire procedure and perioperative experience. So usually we'll call the night before. If we've had a late night in the OR the night before, sometimes we don't get to that call, but at some point you will speak to the provider that's going to be doing your anesthesia, normally Tim or I. We go over the anesthetic evaluation the night before, which means we'll ask you a series of questions, and then we'll talk about the anesthesia plan specifically catered towards you and the type of procedure you're having. And it normally goes like this. So I'll ask you questions such as your height, your weight, the medications that you're currently taking, any allergies to medications, all questions similar to the questions the office asks you, but we like to do our own pre-anesthetic evaluation just so we make sure we have all the information we need to give you the best possible care. We'll also ask you if you've had any trouble with anesthesia in the past, what surgeries you've had, and what health issues you might have that might help us to more fine-tune the anesthesia towards each patient. So we do all IV anesthesia for the most part. I'm going to speak generally. For most procedures, we do all IV anesthesia, which means no breathing tube, no anesthesia gases, nothing like that. Everything's IV. Now, to be clear, it is still general anesthesia, meaning you're going to be completely asleep. You're not going to wake up in the middle. You're not going to be aware of anything that's going on. You're not going to hear anybody having conversations. You're still very much asleep. But by avoiding some of the post-op nausea vomit triggers, such as anesthesia gases that normally would be used to help keep you asleep, we can avoid that post-op nausea and vomiting, which is fantastic. Most patients will report that they would rather be in pain than nauseous after surgery. So Tim and I are very, very hypervigilant about helping to prevent nausea. It's always better to prevent it than treat it. So we have some of the lowest post-op nausea vomiting rates of any facility that I have been involved in the past 16 years. Is less than 0.5% of population experience nausea after this procedure because we give a number of things to help prevent it. So back to total IV anesthesia. We'll meet you in the pre-op room after you've gotten pictures, after you've met with your surgeon. We'll bring you back to the operating room, put a very small IV in you. We don't need anything big. Normally, we'll go in the bend of your arm. We don't need to go in the hand. Most patients are very fearful of having an IV in their hand. And those that are very nervous about the IV find afterwards that it was nothing to worry about. It's very small. And oftentimes we'll put a little local anesthetic in the area so you don't feel IV at all. We'll start giving you a little relaxant medicine once we get the IV in while we get some monitors on you. Before you know it, you're waking up at the end of the procedure and we're done in recovery. Recovery usually lasts anywhere between usually 30 minutes to 45 minutes. Because of most of the anesthetics that we use wear off rather quickly, most patients are sort of pretty much, I wouldn't say wide awake, but much more awake than they would be if they were in a hospital setting doing this, breathing anesthesia gases, getting a large amount of IV opioids. And so we found that patients are less likely to stay in recovery much more than a half hour or 45 minutes. If you're going home that day, the registered nurses in recovery will take you down to meet your driver, meet your ride. If you're staying in-house in the suites, we'll bring you downstairs to meet your caregiver. We also get a lot of questions about IV antibiotics. For the most part, everybody does get prophylactic IV antibiotics during their procedure. Prophylactic meaning to help prevent any sort of surgical infection. Our surgical infection rates are very, very low, as they are across the country and across the board for plastics and cosmetic surgery, but we do this as a preventative measure. So yes, if you have an allergy to a specific type of antibiotic that we're going to use, specifically Ancef, then we can fine tune it. We can customize and use another choice of antibiotics based on your allergies. Eating and drinking. Everybody wants to know about eating and drinking. We get this question all the time. It's the most popular question. When can I eat? When can I drink? When can I eat? So we have the office tell everybody, do not eat or drink anything after midnight, because until we get a chance to review the schedule, we, meaning Tim and I, the night before, we don't know if there's been some changing around the schedules. And so this allows Tim and I a chance to fine tune the eating and drinking guidelines once the schedule is set the night before. Unfortunately, I wish we could predict all the surgery schedule changes. Some patients get sick the night before. Some patients have family members or emergencies that need taken care of. And so unfortunately, the schedule does change a little bit. So this allows us to look at the schedule the night before and adjust it. So if you hear us on the phone tell you, okay, let's just talk about eating and drinking, it's because we have looked at the schedule and we're going to fine tune it. The safety guidelines nationally for anesthesia are 6 hours before your procedure, you can have solid foods, up to 6 hours before your procedure time. For clear liquids, it's up to 2 hours before your procedure time. Okay, so in other words, if you're having a 12 o'clock noon surgery, technically you can have breakfast as long as it's before 6 a.m. because that's 6 hours before your surgical time. Nothing to eat after 6 a.m. But you can continue to have clear liquids until 2 hours before your procedure time. If you have a noon procedure time, that's going to be 10 o'clock. You can have clear liquids up until 10 o'clock. Nothing at all after that 10 o'clock for that 2 hours prior to your surgery, okay? We get a lot of confusion around this, and we try to make it very clear. We don't want to just tell everyone don't eat or drink anything after midnight the night before, because if somebody has a 4 o'clock surgery time the next day, that means 12, 14, 16 hours can go by that they've not had anything to drink, they've not had anything to eat, and then we just end up chasing their fluid status, and blood sugars can be low. So we try to respect the patient's needs as well, your needs as far as eating and drinking too. You don't want to be completely dehydrated. You don't want to go the whole day without eating and drinking, so we're going to adjust that. What medications to take the night before or the day of? We're going to go over that list with you, or Belinda, who does your pre-op. We're going to talk to you about which medications. Typically, we want you to keep taking your antihypertensive. If you're on medications for high blood pressure, we want you to continue taking those. If you're on medications for diabetes, we're going to adjust that. We typically want patients who are diabetics to be the first case of the day, because we don't want to interrupt their glucose status, okay? Might have you bring in your glucometer with you so we can check it on your monitor, but we'll go over all of that before your day of surgery. I wish I could go over every medication that would be appropriate for you to take the day of your surgery, but that's more of a conversation that needs to take place patient to patient with Tim and I on the night before your surgery, and we're happy to do that, and we'll go over that list. All right, post-op pain management. We want you to bring your prescription medications on the day of surgery with you. Why is that? Because we use very strong pain medications in your IV during your procedure, which is great, but they don't last very long, which is good. We don't want them to last long. We don't want to give you a lot of IV pain medicines that are very strong and send you out the door. Where ours leave off, we want your medication to be taken by mouth, your prescription medications that your surgeon has written for you, to take over where ours leave off, okay? I wish I could say there is such thing as pain-free surgery. I can't say that. Anybody who does tell you that, you should be very cautious of. What I can tell you is that we can target about 95% of the pain receptors with a combination of what anesthesia is going to be doing with IV medications to help prevent and monitor and manage pain control, and what the surgeons will be doing. They'll be using a variety of local anesthetics in the area that they're working on. And a combination of those two efforts, we can usually target about 95% of the pain receptors. Now, is there breakthrough pain? Yeah, very possibly. More of discomfort, and that's where your prescription medications are going to take cover. What about nausea? Again, I talked about nausea before. Is it an issue? 0.5% of the population is an issue, but we still have medication we can give you in the recovery room if you fall in that small percentage of the patients who do experience nausea postoperatively. It's not a problem. We do not give that to everyone because it's very sedating. It's Phenergan. So we reserve that for those patients who are experiencing nausea in the recovery room. Safety-wise, we have all of the safety mechanisms in place and follow the same standards of care as the hospitals. We are Joint Commission accredited, so we have all of the safety protocols in place. If you have any questions, I would encourage you to reach out to your surgeon, but probably more importantly, Belinda. Belinda is fantastic at doing all of the pre-op patient care, getting everybody ready, all the questions answered. If we don't have a chance to call you the night before your surgery, Belinda will call you and go over your NPO status. Again, if you do have any questions, we will call you the night before. Thank you for tuning in. It's got a little long-winded, but myself and Tim McAdams, and on behalf of all the surgeons, we thank you for letting Cranford Cost of Plastic Surgery take care of you. Thank you.